You'll notice. All right. While everyone is joining us, I wanted to remind you of the events at the center this week. On tomorrow, on Wednesday at 10:15 a.m., we have the second event of the Philosophy of Physics Senior Visiting Fellow Seminar, Cosmology Beyond Space-Time, organized by Nick Huggett and Chris Wüstrich. And tomorrow, Christian Wüstrich from the University of Geneva is going to be talking, so at 10:15 a.m. And the title of his talk is Laws Beyond Space-Time. And you're all invited to join us if you're interested in Chris's talk. Please go to the center's website and you'll find a link on the calendar to register for his talk. On Friday, John Norton, who had to cancel his lecture last week, will be talking on how to make possibilities safe for empiricists. Please note that the lecture is at 11:30 and not noon. So the lecture is a little bit earlier. Again, if you're interested, please go to the center's website and register for John's talk. And next week on Tuesday, Kevin Zollman will be from CMU will be giving a lecture on conformity, social networks, and the emergence of pluralistic ignorance. And again, you can register for this lecture on the center's website. Just to refresh your memory, we're using webinar. If you have a question for our speaker today, go to the bottom of your screen, click on the Q&A button, and just write your name. And during the Q&A, I will promote you to the status of panelist, and you can ask a question directly to our speaker. So it's my real pleasure today to introduce Nick Byrd, who just got his PhD, I mean, not just anymore, who got his PhD last year from Florida State University on reflective reasoning for real people. This year, he's spending a year at Carnegie Mellon University as a fellow with the Intelligence Community Research Fellowship Program. And next year, he will be an assistant professor in the I don't think he's got a department of philosophy, but in philosophy at Stevens Institute of Technology in New Jersey, right across Manhattan. Lovely place. And Nick works on a range of topics in cognitive science, in the philosophy of cognitive science, in experimental philosophy, and also about what it is that we philosophers do. He's done actually quite a lot of impressive work on the notion of reflection, both empirical and theoretical. And today, Nick will be talking about philosophy of cognitive science and cognitive science of philosophy. Nick, the screen is yours.
All right, thanks, Edward. Yeah, so that was a great introduction, kind of covers my interests and my areas, as I am trained in both cognitive science and in philosophy, so I kind of do both, one of the other, so to speak. So before I get started, I found it's kind of helpful to address what some people have, I guess, considered the elephant in the room whenever I give a talk, and that is, yes, I've heard that I look like a famous person, apparently. And it doesn't bother me to get this question whenever I'm not at home. So I probably benefit from looking like someone who's, talented and well-liked, and who I think has pretty cute children as well. So now that I've addressed that, we can get to the content of the talk. So the talk today is really a collaboration with Mikhail Bialik. And it was actually funded by some money from a fellowship that I had when I was at Florida State University. And the main topic of the talk is the psychology of complying with public health recommendations during the COVID-19 pandemic, in 2020. And I guess it's ongoing. This research was conducted in early 2020. And the origin story of this paper is Twitter, actually. I was running a poll, and I wanted to know if sharing stories about the COVID-19 pandemic would be more motivating than sharing statistics. And after learning that most people who voted in the poll expected stories to be more motivational than statistics, Bialik reminded me that that expectation probably aligns with what is called the identifiable victim effect, laid out by people like Paul Slovic and George Lowenstein at CMU. So I confess that I kind of would expect an identifiable victim effect to work during the COVID-19 pandemic. So I thought depictions of individuals would motivate people to comply with public health recommendations more than, say, flatten the curve graphs or other types of charts and statistics. But I also expected that reasoning measures might mediate this effect, such that, if you're more into math and certain types of scientific reasoning, then the charts actually might be your jam, and the pictures of the individuals might be no more motivating than those charts. So I became tempted to test my expectation and the expectations of others, and McCall was on board, and I had just had a bunch of conferences canceled, so I had all this funding to figure out what to do with. So I reallocated the funding to some research and ran some experiments. So in case you're not familiar with the identifiable victim effect, let me just provide some background. So there's a decades-long history of expecting people to care more about individual victims than statistical victims. So Ross and Nisbet tell us that Joseph Stalin said, "The death of a single Russian soldier is a tragedy, but 1,000,000 deaths is just a statistic." And Paul Slovic cites a series of papers finding, in his words, people are much more willing to aid identified individuals than unidentified or statistical victims. And philosophers have been aware of our remarkably ineffective responses to crises and victims around the world as well. So some philosophers have argued that we actually have a duty to do better. And many of these philosophers call themselves effective altruists. And one famous argument from Peter Singer has this key premise and goes like this: if it's in our power to prevent something bad from happening without thereby sacrificing anything of comparable moral importance, we ought morally to do it. So now consider the COVID-19 pandemic, right? Take yourself back to February, March of 2020, when public health officials were recommending these kind of low-risk, straightforward methods for preventing millions of deaths during the pandemic. But some leaders and individuals were just kind of fatally resistant. And you might want to know, like, why? It's just wearing a mask. It's not this huge cost. It's just staying home instead of going out for dinner. It's not this enormous burden. And what's at stake? Millions and millions of lives. So it seems like we can prevent great harm without thereby encountering some greater harm. Why wouldn't we? You might wonder how messaging impacted people's responses to these public health recommendations. So you might think, well, maybe it was the flatten the curve graphs that focused more on statistical victims than identifiable victims. Or you might think, actually, it was other types of messaging that did it. It was that leaders compared COVID-19 to seasonal flus in 2020, even though their public health officials kind of debunked that comparison. And so the idea is that by comparing COVID-19 to the flu, it kind of decreased public health compliance by decreasing people's perceived threat of the pandemic, right? If it's just a flu, then what's the big deal? We don't do all this mask wearing and staying at home for the flu. So maybe it was these comparisons to the flu that were driving the resistance to public health recommendations. But you might also kind of just look at the individuals and say, well, what was it about the individual's response to the messaging that might explain their resistance? And so, many people did comply with the recommendations, but other people were kind of creating and spreading conspiracy theories. And it turns out that people who were less reflective were especially likely to be associating themselves with these conspiracy theories about pandemic public health responses around the world. So maybe it's people's reasoning that's driving this resistance to public health recommendations. But then you might also think, well, part of what's going on is people have these prior beliefs about various things, and that's impacting their assessment of the pandemic and what we ought to do about it, kind of independently of what they think about, COVID-19 or vaccines or whether a mask works or not. Some people just think like, liberty matters a lot, and anything to prevent tyranny from government. And you might think that, certain religious groups also want to exercise certain forms of liberty by continuing to hold crowded services, even though there's a known risk to public health, because, perhaps they think there's some higher value or being that they care about that transcends whatever this pandemic thing that's going on. And so there's a few factors here. And, the question that's driving this research is, why would otherwise life-affirming people have resisted these easy to adopt and expert recommended practices when there were so many lives at stake and so many more lives at stake, going forward? And the research that I've alluded to and the reporting I've alluded to suggests that there's, at least three factors. There's the content of the messaging, there's the receiver's reasoning, and there's people's philosophical beliefs about liberty and politics and maybe morality and religion and other things. So in April and May of 2020, my collaborator and I decided to test the identifiable victim effect, controlling for these variables such as reasoning and philosophical beliefs. So first, participants were shown a list of public health officials' recommendations, similar to the ones you've probably seen on posters at work or at home or at grocery stores or wherever they can be posted. They recommend things like hand washing and mask wearing and staying at home unless you have some essential activity that you need to complete. So you're probably familiar with these. So after participants were presented with this list of public health recommendations, they were randomly assigned to one of four messaging conditions, forming a sort of 2x2 between subjects design. So each visual image was about either a statistical or an identifiable victim of either a COVID-19 or a flu pandemic. And the idea here is perhaps intuitive. We're trying to test what the effect of the identifiable victims are, as well as the effect of comparing COVID-19 to the flu, because both of those things could feature in messaging and could have an effect on compliance. And so we wanted to test for both at the same time, thus the 2x2 design. So our primary outcome variable was a validated compliance measure from Jim Everett and colleagues. And the scale asks participants about the likelihood that they're going to comply with various public health recommendations right after reading this message, the visual image that they were randomly assigned to, as well as getting the information that public health officials recommend these things. So they put on the sliding scale how likely they are to do each of these 5 items. And the reliability of this measure was, just like in past studies, actually quite high. These items correlated with one another quite well. And then Anton Gollwitzer and colleagues have found in a few population level studies that responses to measures like this actually predict real world social distancing behaviors kind of at the population level. It's a really interesting paper. So there's a bit of evidence to suggest that this is not only a reliable scale, but it's tracking something that correlates with real world social distancing behavior during the pandemic. So right after, or I guess in the midst of answering their compliance items, participants also told us how much of a threat they thought the pandemic was to society. And so they just rated their agreement with this scale. And the reason we included this is because there was a few papers at the time that were suggesting that part of what's driving people's responses to the public health recommendations is not just like their moral beliefs or their politics, but like how serious of a threat they think this is. And it's actually one of the best predictors of compliance in some studies. So we thought we really need to measure this, control for it. Now, some evidence has also suggested that the identifiable victim effects can be moderated by reasoning styles, such as reflective or analytic reasoning. Also, this is something I care about, so we're going to have to take a detour and talk a little bit about reflection. So, as you may know, psychologists have developed tasks that can reveal whether people are relying on unreflective intuitions or more reflective judgments. And you're probably familiar with some of them. A rather famous test is called the cognitive reflection test. And here's an example of a question from that test. A bat and a ball cost $1.10 in total. The bat costs $1 more than the ball, so how much does the ball cost? And you can try to, think about that for yourself for a moment before I give it away. But the answer that jumps to most people's minds immediately is 10 cents. but that's not quite right. So if you think about the question a bit more, you might realize that the right answer must be less than 10 cents. And if you kind of do the algebra, you can figure out the correct answer is actually 5 cents. So the cognitive reflection tests and questions like these are considered reflection tests because they lure us into a particular response that upon reflection, we can realize is incorrect. And I'm actually curious, I know you probably can't say so now, but in the comments or later, I'm curious to know how many of you were familiar with this item prior to seeing, the answer, and maybe had the answer memorized or had remembered that there's a trick here and I need to pay careful attention. If you remember those things, that would be interesting to know at the end, because this measure has been used since 2005 in many studies, and you might wonder if people's familiarity with it is a problem, which I'll talk about in a moment. So the bat and the ball problem is not only familiar, but it's also a math test, right? It measures not just reflection, but things like how good you are at math, right? It might be that you reflect a lot on this problem, but you don't have the basics of math down and therefore don't do well on the test. So there's plenty of research suggesting that this widely used reflection test may not be more than a math test. So Eric and colleagues found that the latent numerical CRT and numeric ability was so high that the constructs were practically indistinguishable. Atali and Bar-Hillel found that the predictive quality of CRT and math problems did not depend on whether they had a lure, but rather only on their quality as math items. And Patel and colleagues did a factor analysis which found that CRT loaded onto numeracy and insight problem-solving ability rather than its own unique factor. So we were careful not to just use the original CRT, which is mathematical to the point of being redundant with mathematical tests, perhaps, and also widely used and therefore familiar to many participants who might be in our studies. So in our studies, we had participants complete less familiar and less mathematical versions of reflection test items. We did have one or two mathematical reflection test items in the reflection test, but it was just one or two out of 3 to 6 or something like that. So it was the minority of the items. The other items were based more on logic or just kind of like verbal reasoning. And I've included some examples here so that you can judge for yourself how mathematical you think these are. These are also either directly pulled from or adapted from what's called a verbal reflection test from Miroslav Soroti and colleagues. They developed a 10-item test that's supposed to be less familiar and less confounded with math. So in study 2, when we thought more about this potential confound with numeracy, we thought we might as well just throw in an actual measure of numeracy to control for that in particular, since our CRT test itself might not be as mathematical as others. And so we might need an independent numeracy test to control for it. So after completing all those measures, participants also completed various philosophical items. And I'm just showing you a few examples of them. There's quite a few more that you'll see later in the talk. But these were adapted from Bourget and Chalmers' Phil paper survey, as well as some other kind of validated scales like the religiosity item you're seeing there. And so they kind of just gauge people's preferences about various philosophical topics, such as scientific realism, or whether people prefer liberty to equality, or the effective altruism principle that we've adapted into a more common language measure here from people like Peter Singer, which was not in the Phil paper survey, but was included in study 1 and study 2. All right, so in terms of the demographic and participant information for experiment 1, it was run in April. We thought we would need about 250 people to detect the kind of effect size we wanted. We used cloud research instead of just going straight through MTurk, because cloud research has, in my experience and others' experience, shown to produce far better quality data and far less low effort responding from MTurkers than just going straight through MTurk. So cloud research has this thing called Sentry. That's a capitalized acronym standing for something that I don't remember right now, but they have people complete various tests, and they actually check people's VPNs and do all sorts of like bot checking and low effort responding checking and attention checking and kind of dishonest responding based on VPNs and IP addresses. to kind of root out a whole bunch of MTurkers that they don't want in their sample because they can produce crummy results. So we used cloud research for this reason, but we also use our own attention check. And after kind of, eliminating people with our own attention check, and then also only including people who passed cloud research's data quality, we got 246 people in our first study. And in the first study, we included only the effective altruism philosophy item because we needed to reduce the length and the cost of the survey, just to see what we could find initially before we invested a lot of money in a larger follow-up replication and extension. We did end up running that larger study that was run in May. It had, after excluding the people who produced low quality data, had 752 participants, so roughly triple the sample size. And this is the study where we added the numeracy scale and a bunch more philosophy items to kind of clarify what we found in the initial study. So as you're seeing, I'm going to kind of present these in serial order rather than, in parallel, as opposed to one after the other. So here's just the correlation table from study one, just to get a general idea of what's going on in the data set. I like reporting these in part because when people run meta-analyses later on, it really helps if they can just kind of pull out a correlation, a sample size, mean, and a standard deviation. And if you have all that right in the paper for them to find, then they don't have to download your data and analyze it for themselves. They can just kind of read the paper and find it and run their meta-analysis. The other thing this helps us do is figure out how well our findings map onto others' findings. So that's what we'll discuss here. So the public health compliance items correlated very strongly with one another and with perceived threat of the pandemic, which is what you'd expect. People who thought the pandemic was more of a threat are more likely to wear masks and wash their hands and shelter in place, et cetera, et cetera. Replicating other work, compliance was higher among older people and among women. And replicating prior results, reflection test performance was not a strong predictor of compliance. Interestingly, the effective altruism principle that people could rate their agreement with strongly predicted compliance with public health recommendations. So that was kind of our first sign that philosophical preferences might be relevant in this investigation of people's responses to public health and public health messaging. But we also wanted to test the effect of the identifiable victim effect. And we in particular wanted to test for the identifiable victim effect while controlling for reasoning and philosophy. So we've got here a kind of hierarchical regression where we've got three models. The first model is just messaging. The second model adds in the reasoning items. And then the third model adds in the philosophy item to kind of see how much each of those categories of predictors contributes to predicting variance in compliance and in perceived threat of the pandemic. So we did detect a small identifiable victim effect until we introduced the philosophy item in the far right two columns. And we also found a larger effect of messages about flu on perceived threat of the pandemic compared to messages about COVID-19, but that didn't have a direct impact on compliance. And although we found that reflection test performance was related to both compliance and threat, no such effects were detected above and beyond the large effect of endorsing the effective altruist principle. So this was our first clue that the philosophical preferences might be really driving people's responses to public health recommendations, maybe even independently of messaging or reasoning. But again, this was our first study, it was our initial results, and we wanted to see whether or not these were a fluke, so we ran a follow-up study. And the second study included quite a bit more philosophy items, like I mentioned, as well as a numeracy item, so its correlation table is quite a bit larger, but we can kind of zoom in on what's more important here. And we see once again that the public health compliance items correlated strongly with one another, as well as with perceived threat of the pandemic. So that's just a good sign for the measures. And replicating past work again, compliance was higher among older people, and reflection test performance was not a great predictor of compliance. However, effective altruism, or agreement with effective altruism, was again the strongest predictor of compliance in this univariate analysis, as was scientific realism, and the best predictor of non-compliance was preferring liberty to equality. You can see the mean there is right at the center of the scale, suggesting that people who were left of the scale were, that is, preferring equality to liberty. Sorry, people who preferred liberty over equality were far less likely to comply with public health recommendations, is the takeaway there. So again, we want to look at the hierarchical regression in order to figure out what predicts compliance when we're controlling for all of these other factors, rather than just looking at the univariate correlations from that prior table. So this time we didn't detect the expected identifiable victim effect really at all. But messages about the flu were continuing to reduce perceived threat of the pandemic compared to messages about COVID-19, even though those messages didn't have a direct effect on compliance again. And once again, reflection test performance was not obviously related to compliance or threat. But again, endorsing the effective altruist principle was the best predictor of compliance above and beyond all of these other factors. But in addition to effective altruism, compliance was also predicted by endorsement of scientific realism as well as religiosity. So again, we wanted to know what the best predictor of non-compliance was, and that again turned out to be liberty over equality, again controlling for all of these other factors at the same time. So now you might want to know how our manipulations, how our different messaging conditions might have impacted our control variables. By that I mean the variables other than the conditions themselves, right? So if you were in one condition compared to another, did that impact your political views somehow? Like, did you become slightly more liberal or slightly more progressive, or did you become slightly more of a scientific realist or less of a scientific realist by seeing the graph compared to the identifiable victim? And is that actually what's explaining the effect we're observing on compliance? So, in the causal graph and causal inference lingo, you ask something like, were our control variables affected by our manipulation, and did those effects collide with compliance? So we're asking questions about colliders here. So to test this, you can run mediation, right? So we did that, and this revealed a pretty similar picture. There was no direct or indirect identifiable victim effect on compliance. But messaging about flu indirectly reduced compliance compared to messaging about COVID-19 by reducing perceived threat of the pandemic. You might remember in the hierarchical regression, that was the one kind of consistent messaging effect that we found. People found the flu less threatening than COVID-19, and therefore their interest in compliance, or their likelihood of compliance, was lower. And we're seeing that indirect effect here in this mediation analysis, controlling for all of those variables in the center. Moreover, after we control for all of those measured variables, many of the philosophical preferences that people reported continued to predict variance in compliance with public health recommendations, suggesting that, again, the philosophy atoms are doing quite a bit of work in explaining variance in compliance with public health recommendations. So together, we think these data suggest that flouting public health recommendations may be less about ineffective messaging or people's reasoning than about their prior beliefs. We also have begun to wonder if these data could lend credence to the concern that those who compared COVID-19 to the flu may have increased everyone's risk of infection and death by reducing public health compliance, by indirectly reducing the perceived threat of the pandemic. So that's something that we'd be interested in discussing as well. So I'm actually going to stop there so I can leave a lot of time for Q&A and discussion and the like. If Edward and colleagues want to get that ready, I'm happy to do that.
All right, so that leaves us actually a lot of time for discussion. Please, as I mentioned in the chat, If you have a question for Nick, go on at the bottom of your screen, click on the Q&A button and just write your name. And then I'll promote you to the status of panelist, and you can ask your question directly to Nick, so I don't have to. Shaheen, actually, you have a question, so please go ahead.
Thank you. Thank you for the talk, and I really appreciate the empirical nature of your work. I was wondering, what about trust? You didn't test for trust in any of this, and I wonder if that is a lot of the measures that you're using are confounded with trust. And like public health officials were saying, don't wear a mask, don't wear a mask, don't wear a mask. And then overnight, they're like, no, wear a mask, wear a mask. Everyone who doesn't wear a mask is an idiot. And so I can see a lot of people being like, wait a minute, like, are we supposed to just wake up in the morning and change our behavior? Just some dude said so. Like, what they said, they were saying the otherwise yesterday, right? So that's just one element of trust. And then if that's embedded in the current atmosphere where like no one trusts people in charge on either side, and everyone thinks there's some sort of plot going on and they're trying to take over or something or another, and we know people lie and people are biased and partisan and everything, and so just the trust levels are extremely low right now, and I wonder if that would have made an impact on any of this, and that would have correlated with things like preferring liberty to equality might be just like a proxy for trust, right? People who prefer liberty more trust government officials and bureaucrats less, so I was just wondering about trust.
Yeah, I think that's actually a really good point. So in the paper, we bring this up, and in particular, we bring it up with respect to scientific realism. So there's a lot of related research that was happening around the same time, slightly before ours and slightly after, showing that trust in science predicts quite a lot of variance in compliance with these recommendations. And what we found is scientific realism, or believing that scientific theories are true, so to speak, is what predicted in our data set. And you might think, well, what's driving our result of people thinking that scientific theories are true is their trust in science, right? So it's trust is the latent factor that we're tracking there. And I think that's totally plausible. And I wish we had the foresight to measure something like trust, as well as maybe trust in certain leaders themselves, right? So trust in Fauci versus trust in Trump, even though they're sort of a part of the same group, at least they were at the time, right? And so I have a feeling that would have predicted quite a lot of variance. I think our colleagues at CMU have some initial data suggesting that the best predictor in their measures was support for Trump. That was the best predictor of compliance in their own data. They've actually adopted some of our measures to see if our measures can predict as much or more variance. So I'm actually really curious to see what their results are. But point well taken. I had not considered the connection between trust and liberty, in that people who are maybe have more libertarian preferences might just be less trusting of authority in general, including scientific authority. And so you might think that that's actually also related to what we're finding. So yeah, I think that's a great point. And I hope we can get some clarity on that, either in our own research going forward or in others.
Thank you.
And Nick. So since there is no question immediately, I had an observation, and but maybe I missed something. I was a bit surprised to see that religiosity predicts compliance, in part because I would have assumed naively maybe that religiosity correlates with political orientation. And of course, political orientation strikes me as a very good predictor of whether or not people are going to be wearing a mask or not. So what's going on there? Maybe religiosity just is not actually to be identified with religion. I'm not exactly sure exactly. What do you make of that?
Yeah, this is a great question, and it's something that is really interesting to me. So, and in part because theism kind of marginally predicted some variance in study 2. So I'll just kind of go back to that slide real quick, because I think there might be an interesting question. Yeah, so I don't know if you can see my mouse or not, but
Yeah.
the theism was marginally predicting compliance in the hierarchical regression, as was religiosity, but religiosity was predicting quite a bit more variance. And so you might wonder what's going on, what's the difference between theism and religiosity? And you might recall that our religiosity measure is actually a question about your community involvement. I think it's like, to the extent that religiosity is involvement in organized religion, how religious are you? It's not what do you believe, it's like what kind of community are you involved in? And so I'm actually wondering if what's driving the result there is involvement in a community. And there's this intuitive story I can tell myself about how, well, people who are more involved in a community are going to be more pro-social and therefore more likely to comply with these recommendations that are supposed to save millions of lives. But that doesn't follow directly from our data. So I would be curious to see studies looking at religiosity and other forms of community involvement. So like secular community involvement, whatever, book clubs, I don't know, whatever those would be. And looking at how those different types of community involvement differentially predict compliance. Because my question is it the religious beliefs that are doing the work here, or is it just the pro-social community that's doing the work? And you might have hypotheses about that, but either way, I'd like to know that. I wish our data could speak to that better.
Thanks. Yeah, that's really helpful. Actually, that quite a plausible speculation. Anyway, yeah, I agree.
Hi, Edward, and thank you very much, Nick, for the excellent talk. I wanted to ask about sort of the initial preamble. You discussed, you kind of looped the easy measures, let's call them that, of like wearing a mask and washing one's hands, with the measures of not going to a restaurant to eating in. And I know from experience of South Africa, so where I was at the time that you were doing this research, those things were quite different. So the one was almost like death to the economy, and much more connected to those kinds of issues than the other one, which might have involved the kinds of reasonings you're talking about in terms of, well, this is minimal effort for me to, help others and things like that. So I was just wondering about how the economic connection between some of these so-called sort of easy procedures. What do you think of the connection between those?
Good. I'm glad you're bringing it up, because the story I tell at the beginning, the preamble as you called it, is maybe that it's a story, right? And so I wonder if I could benefit from thinking more about how it actually relates to the data. Because in our data, we did not find that, say, social conservatism versus liberal conservatism, which is supposed to be largely a measure of people's economic preferences. We did not find that had significant predictive power on compliance. And so you might think that this distinction you're drawing between mask wearing and economic activity, like going to restaurants, are actually dissociable, right? People who want to wear masks and protect people might also be the people who want to frequent certain businesses to keep, certain types of economic activity going. And that seems compatible with our data. And so maybe I should update the story, or just, use slightly different language about whatever I mentioned about going to a restaurant, because it seems like that's not quite the right way to describe it. I guess it was a curiosity going into this, but yeah, maybe I should update it now that we have the data.
Thanks, Nick and Ryan. Greg, floor is yours.
Yes, thank you very much for your talk. I appreciate this. This is obviously going to be a topic of much greater future inquiry and research. But since you got a head start on it, I was wondering if I don't see anywhere where the single most identifiable victim, namely the self, the individual, is listed as a factor. And very early on in the pandemic and in the public health messaging, it got out into the general public that certain groups of people were much more susceptible to COVID-19. Elderly, people with pre-existing conditions of various comorbidities, as they were called, also people of various disadvantaged social and economic groups. So all the public health mechanisms, methods were also private health mechanisms. Washing your hands, putting on a mask also protected yourself in addition to sort of the general public at large. was wondering if you could figure out a way to factor that in terms of your ages. You did mention that seniors in general were much more likely to observe the methods, but your results would stand out much greater if they were statistically significant within the groups of people who were considered to be, who personally saw themselves as possible, as more likely victims of COVID-19.
That seems like a great point. I don't think I've run the analysis of, like, say, ethnicity to see what that does in terms of predicting differences in compliance or perceived threat, perhaps, since you did mention that there are some differences between the same marginalized groups, one of which might be marginalized in terms of ethnicity. So yeah, that's actually a valuable point that could motivate some some reasonable analyses that aren't just post hoc p-hacking, but theory-driven analyses that could illuminate more. So I guess I'll just mention that all of the data is on OSF if somebody wants to run that analysis. But if I have the time soon, I might be interested myself in running those numbers as well. But feel free to have at it, because it's all available to you if you just go on my OSF page.
Thanks, Greg. Thanks, Nick. Any other question from the audience? Again, all right, Kelly, let me just try to move you. All right, Kelly, the floor is yours as soon as you are join us as a panelist. All right, go for it, Kelly.
Hi, hey, Nick. So I guess this is just two things. One is a follow-up to Greg, which I think this is a great point. I remember having conversations with people at the beginning, namely people in my family, at the beginning of the pandemic, and feeling like I was doing a lot of work to try to elaborate not just the fact that this is a threat to us as individuals, but also that like it's much more of a threat to other people. And for that reason, we had some responsibilities to do these mitigation efforts. So I wonder if there's something about like not just gauging the threat to you as an individual and that being a significant predictor of compliance, but also gauging the threat to other people and other particular vulnerable groups, and thinking that that itself should also be a reason for compliance or a motivation for compliance. I think that would be interesting because like also people have pointed out that this was this seemed to be part of the confusion of the public health messaging, is trying to get across this idea that like, we're not just doing this because it's a threat to us, but like it's the threat to other vulnerable people. And you don't really know, you might not necessarily know the ways in which other people are very vulnerable to this. And then the other thing is I was wondering about the philosophical commitments elements of this. So I think the liberty versus equality position is a really, really interesting thing going on here. It's also interesting that that seems to have a stronger effect than like social conservatism or economic conservatism, which we tend to think as being like a sort of bundle effect of people's philosophic commitments. But I wonder if you've given any thought to the fact that that's phrased as a clear value commitment or value position, as opposed to something like the scientific realism or scientific anti-realism prompts are phrased as more like, here's a statement of a theoretical position that you could or could not agree with or agree with to a certain extent. So do you think maybe you might find other like strong effects of the influence of specific value commitments if they're phrased as value commitments? Because I could imagine like you could phrase the liberty and equality as two separate prompts that are just statements of philosophic positions, but it maybe might not have as much sort of like force for people as framing it as an explicit value commitment.
Okay, good. I'll try to start with the first one. I'm glad you kind of followed up on Greg's point, because the more you were talking, the more I was kind of appreciating parts of Greg's question that I don't think I appreciated the first time around. So that's really great. So, right. So one of the things you're helping me pulling out is the idea of that, right, we have this perceived threat of the pandemic on some level, and it might be that there's two different types of perceived threat there. There's the threat to ourselves versus threat to others. And then you might even think in this threat to others, there's this further distinction, like threat to others like me versus threat to others who are particularly vulnerable. And I guess actually you could be one of the particularly vulnerable people, so that could also be like you. But the point is, threat to myself versus threat to others, and in the others, is it just anyone, or is it a particularly vulnerable person? So there's a kind of like 3 levels there, at least, of perceived threat that could be drilled down on. Yeah, so that's actually something I'm a little less confident that we could speak to empirically with our data, because we didn't kind of draw that distinction out in the measure, sort of like we didn't draw out the distinction you're making about politics and values versus abstract principles.
It could be an interesting follow-up study. I mean, at least a lot of
yeah.
discussions in some minority communities is like, was it explicitly an issue of solidarity?
Right.
And that was not something that was really that seemed to be part of a lot of the, mass public health messaging.
Good. Yeah, I like this too, because one of the things, lots of people do in their studies that I also do is just including an open-ended comment, optional comment at the end. And I find that lots of people are very interested in sharing their thoughts and opinions and experiences of these. And so there's lots of ideas I can get from them. And I would be interested to see if this type of question is coming up. Because lots of people will say like, hey, you asked about this, but were you asking about this part of this or this other part? And so people might be making the same distinction you're making. And if lots of people were doing that at the time, that suggests that there's even more reason to investigate this. I wonder if, with the second point about liberty and these other political ideas being values versus kind of abstract principles, I think I understand the distinction, but I guess I'm wondering if you could give me an example of like what's a more value laden construal of it versus an abstract construal, so I could maybe get a better idea of the distinction.
Yeah, maybe something like for the scientific realism, be the value of, I heard this is just a first pass, like off the top of my head, the value of getting at the truth versus the value of satisfying other pragmatic objectives. I don't know. But something that would get at, the realist position being that we should figure out what is true first, and then figure out what we should do on the basis of that.
Okay, yeah, so it could be like phrasing it like, rate your agreement with the following. We should, so you kind of identify with yourself, we should make sure that science is aimed at truth, versus something like scientific theories are true. Yeah, so I could see those 2 different items producing different outcomes. Okay, that's helpful, thanks.
Because there's been lots of discussion, I don't know if anyone else is in the queue, I'll stop it. There's been lots of the discussions of these phrases like, we just need to follow the science.
Yeah.
We just need to listen to the scientists, like science will tell us what to do. And there's a conflation of like, science will tell us what to do versus science will tell us what's true.
Good.
Yeah.
Yeah, so I'm quite friendly to instrumentalist views of science, but that doesn't make me any less interested in the science of this pandemic and what I ought to do about it. In fact, part of the reason I'm interested in the science is that I think it's the most reliable indication of what I ought to be doing, as a responsible citizen, so to speak, even if I don't care if the theories are like strictly speaking true. It's this more instrumental point. So yeah, so this is helpful for distinguishing, again, what's going on in the scientific realism measure, because it could be many different latent variables there. And yeah, I'm not sure which one is doing most of the work, or maybe multiple things are doing the work. That's really helpful. Thanks, Kelly.
Thanks, Kelly and Nick. Any other question? Brian, just give me a second and I'll promote you. Brian, the floor is yours.
Hey Nick, I just wanted to follow up on something Kelly was saying, particularly with regard to the scientific realism item. And so you would characterize it as a belief that the theories are true. And I would be concerned that people would bring into that, the response to that item, assumptions such as, well, I don't believe that scientific theories are true. I believe that scientific facts are true, right? So they have this kind of fact theory assumption that, we've all encountered in the classroom that doesn't really, pass philosophical muster. But then also I was curious about how you phrased, say, the realist thesis or the anti-realist thesis in a way that, wouldn't bias your responses one way or another. Right. So, how did you, when you chose anti-realism, did you choose a particular form of instrumentalism, or like which anti-realist thesis would you use, because some are more plausible than others?
Good, yeah. So we were just using kind of trying to use the most common language we could in terms of scientific realism versus anti-realism. And, I have no doubt that we didn't pick up on all the nuances in the literature on this, right? So, and I appreciate this distinction you're making between like scientific facts versus scientific theories, because one might think that, well, the facts are indisputably true, whereas the theories are what's the term, approximately true. And then some other people might think, no, they're just theories. That's the whole point. They're not true. They're just theories. Hold on a second. My cat is getting sick. I'll be right back in about 5 seconds.
That's the first. So... Nick, Floyd, yours.
Okay, he has been put into a safer place. Okay. Right, so scientific realism and anti-realism. So one thing that is coming to mind as you were mentioning the question is the scientific anti-realism measure didn't seem to predict much variance. And you might think, well, that's because it's almost perfectly anti-correlated with scientific realism, and the scientific realism was doing most of the predicting there. And so when you control for that, the anti-realism measure isn't able to predict much remaining variance because the realism measure did it already. But you might also think, well, actually, it's because scientific anti-realism, whatever your measure there, was actually just tracking something else that's just not that correlated with views about science, which kind of brings me back to these other questions about whether scientific realism is really about trust or about these other things that people have brought up. So I guess all of that to say, I think there's plenty of opportunities to be more nuanced in how we measured that. And I'd be really open to suggestions because this is an item I find correlating with other things in my other research, even among philosophers. And I wonder how the wording of the question is driving those correlations that I find. And I wonder if better worded questions might produce different results that are illuminating.
Yeah, thank you. I was curious. I would be curious about the correlation between, say, the religiosity and scientific realism, simply because, I mean, just on the face of it, it would seem that if you score really highly on religiosity, maybe you believe that there is like some robust distinction between, the sort of evolution is just a theory, whereas some things are facts. You don't want that kind of confusion, muddying up your responses. But thank you very much for your response to my question.
Thanks, Brian. Yeah, that did make me think I should have pulled up this correlation table. So I pulled it up here, and it looks like just in the univariate analysis, religiosity, am I looking at the right column yet? Religiosity wasn't correlated with scientific realism, but it was strongly correlated with scientific anti-realism. So that seems to be another indicator that perhaps the realism and anti-realism items aren't tracking polar opposites of one and the same construct. They're maybe tracking two separate constructs, given that they have differential relationships to religiosity.
Cool, thank you.
Mm-hmm.
Thanks, Brian. Any other question? We still have a bit of time. Yes, I believe there's someone else. Reed, let me just give me a minute. I will promote you. All right. Reed, the floor is yours. We can't hear you, Reed. We still can't hear you.
I'll try again.
Now we can.
Yay. So I waited until the end because I actually only have a smaller clarification question. So since we talked quite a bit about how threat can be different according to whether it's a threat to yourself or can you actually show how this was measured, the threat exactly, like what items were used to measure that?
Good, yeah, so that was
I think maybe you already did, but I forgot.
Well, and I go through the slides fairly quickly, so it's totally understandable. This is like my question on every talk. Can you go back to slide whatever, because I needed more time. So this is the measure of threat. It's the same sliding scale as the others with lots of invisible increments.
Actually does refer to society here.
Yeah.
Okay. Yeah, okay, then I can better grasp the other questions about how so a difference could be to replace society to more either a person that you know who is a threat, has this threat, or yourself.
Yeah, that does seem like maybe the most efficient way to kind of drill down on each topic. So the threat to you versus threat to others versus threat to particular vulnerable people. And you might even think of other things.
Okay, thank you.
I guess I'll just mention that this full paper is also on OSF, or I guess it's on SciArchive. So if you find yourself having questions about, kind of detailed methods or discussion type stuff, that's all in the paper. And obviously you can email me or contact me. The paper is currently under review, so I guess it could change, and we'll update the paper on OSF if that does happen. But the latest version, which was updated just a couple weeks ago, is up there for people to look at.
Thank you very much, Reed. Any other question? 1, 2, 3. All right. If not, Nick, thank you very much for this talk, and thanks to all for the discussion. And we hope to see you on Wednesday if you're coming to the cosmology seminar at 10:15 tomorrow, or at 11:30, not noon, 11:30 on Friday for John Norton's lecture. And with that, without further ado, have a good afternoon. Thanks, Nick, again.
Thank you all.
Bye.